Can we use Trivrit Lehyam in case of Aama? When Aama is present, can we use Trivrit Lehyam? How do we select the formula based on Aama?
See, first we need to understand what is Ama. If it is Ama present in the colon, then we need to give Ama Pachana Dravyas. If it is Ama present somewhere else, already it has moved out of the costa, then there is no meaning in giving Ama Pachana in that level. That we can straight away go for the whatever the things are there, clearing the gut. For that purpose, if we do it, then we can drag the Ama from other part of the body to the cleansed colon. So we can select the drugs in such a way that we can do all these things. Second thing, when there is Ama, whether Trivrit Leha can be taken or not, there is no such restriction that there is a Ama inside, you should not give Trivrit Leha. Trivrit Leha will definitely help to remove the vata as well as the stools and everything and the content of the bowel very neatly without causing any trouble or pain to the person. That's why it's called as one of the important Sukha Virechana Dravya. Helps to remove the things with Sukha. So it can be taken. But once again, it is dose dependent. What 5 grams or 10 grams or how much you give it, that depends on the person's Prakriti and even Kosta. Accordingly, or the condition, we can select it.
Looking into that question, my opinion is a little bit controversial regarding Ama. In the Western 1 to 3 year course, most of the Ayurveda schools in US and Europe and even in Australia and all are 1 to 3 years. And when they teach this Ama concept, they kind of extrapolate or generalize Ama concept into each and every disease. So, I am of the opinion that if the Master Charaka or Master Vagbata in the Ashtanga Hridaya and all, if, for example, if they mention about Ama only in those conditions, better we think about Ama rather than worrying about Ama in all diseases. So what happens, I've seen the students is that it kind of misses the point of doing the Amshamsa Kalpana, looking into the doshas behind which are causing the underlying symptoms. So we miss doing that. So probably Ama should be considered only when it is required, sir.
No, usually it is our intention and our duty to find out any Ama present or not in any given case. But once in a given case, we try to analyze and the patient complains and what the history we take it and accordingly, then it is almost, it will be clear whether we need to concentrate on his gut or whether the disease has been extended to all the other part of the body, or Ama is present even in the gut and it is also extended to Dhatu level. So all those things we need to understand. If you feel there is a Ama Lakshanas like glani, not interested in work, heaviness or pain and such type of things accordingly in various joints or in Kapha Pradeshas. So when such things are there, then you can assess there is Ama. Then depending upon the type of person, body weight and the place and even the season, we can go for Ama Pachana with Trikatu Churna for 3 to 5 days initially. That will initiate the Agni inside. It will first what we do, we try to increase the Pachaka Agni. So once there is a Pachaka Agni is improved or Pachaka Pitta is improved, automatically it improves the all other Pittas in the body. And in the form of that, we know that Pitta and Agni is present in the form of the body, and definitely it helps in digestion. So once that Agni is stimulated, it in turn stimulates the all other Agnis in the body. So our intention is to improve the Agni. Once Agni is improved, automatically Amapachana takes place. And then even the blockages, if it is there in the Shrotasas, even that can be opened up by using those dravyas with their potency, like Brahmati dravyas, like Trikatu and Vacha, or even Maricha and Vacha and certain drugs. Then afterwards, when there is a proper Snehana and Svedana, then we can bring back the dosha as well as Ama from the which has entered into the dhatus back to the kosta. Then we can remove them through the proper either form of Ubhayato Bhagara, or it may be from Vamana or by Virechana, whichever the things which is required for us, or whichever the dosha which we are feeling it is a predominant and it is showing the Lakshanas of Kupita Lakshanas. So that type of things are to be assessed, and then only we can go for the proper planning of removal of those things.